All right, welcome back to ABA Exam Review in our Let's Learn ABA series. Today we're talking about antecedent interventions. Antecedent interventions work to prevent behavior from occurring. So we're going to talk about strategies and what antecedent interventions are. RBTs and BCBAs both need to know these for their exam. So if you're looking for RBT materials, check out btexamreview.com, BCBAs and BCABAs, behavioranalyststudy.com. Please like and subscribe. As always, when you pass your exam, let us know so we can include you in our Sunday shout-out. Work hard, study hard. Let's learn ABA. All right, antecedent interventions are based on stimulus control, SDs, and motivating operations. Key antecedent, right? These are happening prior to behavior from occurring. That's why we consider these preventative. Consequence interventions are reactive. Antecedent interventions don't react, right? We prepare, we try to prevent. So we're going to cover characteristics. We're going to go over non-contingent reinforcement, the high P request sequence, and functional communication training. So first, what are antecedent interventions? So we're manipulating SDs and MOs, antecedents, prior to the response. Remember, SDs and MOs have evocative properties. Okay, MOs can also abolish, right? But we're manipulating SDs and MOs prior to behavior from happening so we can change or alter the response. Antecedent interventions are most often paired with other interventions. So remember, we try to use treatment packages. So antecedent interventions aren't always the only intervention we're using, right? We can also be using extinction and differential reinforcement. Notice antecedent and consequence interventions often go together in one plan. Antecedent refers to the event or stimuli prior to the behavior. We also have this idea of contingency dependent versus not. So when we talk about behavior that is contingency dependent, it's under the control of an SD, right? Behavior occurs in the presence of an SD. That's what stimulus control is. If it's independent, we're just talking about motivating operations, right? When motivating operations alter the value of consequences, okay? Behavior is not necessarily dependent, but when behavior happens in the presence of an SD, we call that stimulus control, and we consider that contingency dependent. RBTs don't necessarily need to know that. BCBAs should be familiar with this idea. So first, non-contingent reinforcement, probably what you are most familiar with as far as antecedent interventions go. Non-contingent reinforcement is simply presenting reinforcement on a schedule regardless of behavior. So the idea and the key for non-contingent reinforcement is you're setting up a time schedule. So let's say 5 minutes. Every 5 minutes, you're delivering reinforcement. And it is not contingent on what behavior is occurring. Okay, so if you're using non-contingent reinforcement, you need to use non-contingent reinforcement. And on schedule, you must deliver that reinforcement. Typically, you're going to use either fixed or variable time schedule based on the plan and the needs of the learner. Reinforcement should be delivered based on the schedule, no matter what, not the behavior. And it often acts as an abolishing operation. Commonly, you'll see non-contingent reinforcement used for attention maintained behavior, right? We'll give attention prior to the maladaptive behavior occurring in the hopes that the attention is an abolishing operation for attention, basically. So we give it non-contingently. Therefore, the learner doesn't need to engage in the maladaptive behavior to gain it. So common NCR procedures are positive reinforcement, socially mediated, negative reinforcement, like escape, automatic reinforcement, no social mediation. NCR often prevents maladaptive behavior. So remember, if we're going to use non-contingent reinforcement, we need to abide by some of the same rules as any reinforcement. It has to be function-based, okay? And you're typically trying to abolish the need for the consequence through this antecedent intervention. So understand how that idea works. And again, the simplest way to understand it is if you have a person or a learner who has behavior maintained by attention. If we give non-contingent attention, our hope is they don't need to engage in the maladaptive behavior anymore because they've already gotten what they want. The high probability request sequence, sometimes known as the high P, low P sequence, the high P sequence, interspersed request, pre-task request. You'll hear all kind of different names for it. Whatever you call it, it's the same idea, okay? We're going to deliver 2 to 5 high probability requests followed by a low probability request. It often acts to reduce the value of escape. So, when we need a low probability request to occur, a lot of times the learner is going to try to escape because the low P request is, low P, right? So if we can get momentum built, we can sometimes reduce the value of escape and sometimes reduce aggression that occurs with those low P requests. So how do we implement it? Well, we take 2 to 5 short tasks. The learner has a history demonstrating with compliance. And that's the key here because a lot of people, and a common question is, well, what high P behaviors or requests can I make? You just want to be sure they're simple, they're quick, and there's a history of compliance with that request. You don't want to give a high P request that has low compliance. Okay. You need a consistent request that they're going to engage in, right? You want to immediately present the low probability request afterwards. There should be little to no pause between. And then it's often described as building behavior momentum. So when we talk about behavior momentum, we're commonly referring to the high P request sequence, right? We're trying to build momentum, build momentum, build momentum, and then bam, we go to the low probability request. And then functional communication training. It establishes appropriate communication to compete with problem behavior, often referred to as FCT. FCT is extremely common in ABA. You might be doing FCT and not even know it, okay? It's simple. All we're doing is replacing maladaptive and unwanted behavior with some functional communication, okay? It is that simple, right? We're teaching alternative behaviors or replacement behaviors for the behaviors we don't want to see. The replacement behaviors are going to be affected by the same establishing operations as the problem behaviors, meaning whatever you're replacing, okay, your functional communication is going to be equivalent to that behavior. It's meeting the same needs. Think man training, right? If we have a child who is hungry and when they're hungry, they scream and cry to get food, functional communication training would simply replace screaming and crying with appropriate asking. Those behaviors are functionally equivalent. They meet the same need. Things to remember: FCT creates behavior that produces the same reinforcer as the problem behavior. They're functionally equivalent. And you directly teach functional communication. Okay, this is an explicit instruction, direct instruction. You explicitly teach FCT. So, antecedent interventions, those are 3 major interventions we use. Very straightforward. You probably use these all the time. You might not have even realized you're doing an antecedent intervention. They're very powerful, okay, and we commonly use them in a treatment package. So I'll have an antecedent intervention and then a consequence intervention as well and combine those, okay? So that is antecedent interventions. That is Let's Learn ABA from ABA Exam Review. Please let us know if you have questions. When you pass, let us know so we can include you in our Sunday shout out. Happy holidays. As always, work hard, study hard. See you soon.